Welcome back in. Well, treatment for COVID-19 has had a huge impact on doctors everywhere. Some health experts immediately shifted their attention to coronavirus, while others had their procedures put on hold. Dr. David Fino is a cardiologist with Heart South. He joins us this afternoon to tell us how heart procedures have changed during the coronavirus pandemic. Good afternoon, doctor.
Good afternoon. Thanks for having me.
Absolutely. Well, let's just go right into it. How have heart procedures changed? Of course, we know they have, but how have they changed due to this pandemic?
Well, initially, like most procedures, I think everything was shut down, and cardiology as a field had to learn what was the difference between an elective procedure, an urgent procedure, and an emergency procedure. The emergency procedures obviously continued forward. What we learned after a few weeks is, honestly, there are no elective procedures in cardiology. Most of these do need to be done in a timely manner. And over the time that we've had, we've also learned how to do those procedures in a safe and effective manner while still protecting the patients that are in their vicinity. So there's a lot of factors that go in that we have just had to learn how to work through.
Yeah, absolutely. And there's a lot of things, of course, that we didn't know really towards the beginning of this pandemic about COVID-19. And I know there's still a lot of questions that don't have answers just yet. So can procedures actually be done safely in a COVID patient? Do you guys know that yet?
The answer is yes, and we've, at Shelby Baptist, where I work primarily, and at other hospitals, we've had to do cardiac procedures. We've had to do emergency cardiac catheterizations for determining whether someone's having a heart attack and taking care of that right away. We've done several pacemakers on COVID-positive patients, and the procedure that comes to mind that's making some headway in the news is we've actually hooked patients up to an artificial machine called an ECMO in order to give their bodies perfusion in the event that their whole body goes into arrest. It's called a cytokine storm when this happens. And we've been able to do that safely. It, of course, requires some additional caution by the staff. For example, you have to have a room that's absolutely clean. You have to have negative suction. People going into and out of the room have to be in a bunny suit, we call it, a suit that is protective. And then, of course, you have to shed that outer suit and go back into wherever you were before without that, so that you protect the people that you're going to. And then, of course, face masks, eye protection, all that kind of stuff becomes very important when you operate. We have been able to operate on these patients safely. I myself have.
Absolutely. This is a twofold question here. Does the COVID increase the likelihood of a cardiac event, and does it have any effect on the outcome of the actual surgery?
Great question. So the first part of the question, does COVID itself increase the likelihood of a heart attack and a stroke? And unfortunately, our data are, when it rains, it pours. When these folks get sick, unfortunately, everything happens. They get strokes, they get heart attacks, and as if these poor patients need something else to deal with, a lot of times their cardiac system is starting to fail as well. So unfortunately, the answer to the first part of the question is yes. Now, the second part of the question was sort of unexpected, but we're seeing other cardiovascular issues that are kind of secondary as a result of COVID. And the one that comes to my mind are blood clots in the extremities, blood clots in the heart itself, blood clots in the lungs. Unfortunately, these have also increased in the COVID era, and we've had to deal with them, have a higher suspicion for them in these patients, and take care of them as expeditiously as possible.
All right, doctor, thank you for joining us. Some great information for us as we continue in this unfortunate pandemic.